One situation you may come across is when you find someone and they are unconscious, but they're still breathing. In this scenario, we're going to look at the recovery position. If a patient is on their back and they're sick, they can inhale the vomit and die. The recovery position allows us to lay the person on their side so they cannot choke if they're sick, and we're able to leave them safely if we have to call the emergency services. If they were sick, the vomit would easily flow from their mouth. The patient could be in this situation for any number of reasons. It may be they've fallen over, maybe hurt themselves, or maybe have an illness like diabetes, or maybe they're just feeling unwell. It doesn't matter what's wrong with them, or even if you don't know why they're unwell, the treatment's the same. Firstly, we must approach carefully, assessing the situation and trying to work out what's happened and how you can help.
Oh, bless me, what have you done?
In this scenario, the patient's been found unconscious on the floor. Remove the initial danger of the vacuum cleaner and unplug from the mains. Clear the area as you're going to roll the person over. Introduce yourself. If you know the person, call them by their name. Talk to them as much as possible, as they may seem unconscious, but they may still be able to hear you, as the hearing is the last thing to go. Once you've introduced yourself, just tap on the collarbone. It may be that voice hasn't worked, but by tapping them enough brings them round. If it hasn't worked, we need to check if they're breathing. If their head is to one side, carefully place it in a neutral position. Then we need to open the airway with the head tilt chin lift maneuver. Place one of your hands on their forehead and one hand on the chin. Tilt the head back slowly. What this does is open the airway. The tongue is the most common form of obstruction. By tilting the head, it draws the tongue away from the back of the throat and allows them to breathe. If you did suspect the person had anything in their mouth, check inside as well. Once we've opened the airway, place your ear close to the mouth and look down their chest. We're looking, feeling and listening for signs of breathing for 10 seconds, which is quite a long time. In this case, they are breathing. If they were not breathing, we would deliver CPR, which we'll look at in a later video. Now we know the patient's breathing, keep talking to them. Tell them what you're doing. Do a quick check to make sure there are no other injuries. It may be they've fallen over and have hurt themselves, and there may be blood or other dangers, and by moving them, you may hurt them. In this example, there are no other persons here, and we need to go and phone the emergency services. Therefore, we need to put them in a recovery position. The hand that's nearest you, put out of the way. Don't force it, just where it comfortably lays. Take your hand across the body and pick up their other hands and lay it across their body so that the back of the hand is against their cheek. Keep hold of it. This is to make sure the head stays in the correct position. With your other hand, lift the leg that's furthest away from you and use this as a lever supporting the head while you turn them onto their side. Once they're on side with the leg that's on top, make sure the knee is bent so it supports them on the floor, and make sure the airway is open so any vomit will come out. The whole time, keep talking to the patient, telling them what you're doing, and tell them you're going to go and get help for them. Once you've got them onto their side, go and call the EMS and tell them what's happened, where you are, and if you have any questions, ask them now. If you need them to stay on the phone, they will. Go back to the patient and check they're still breathing and stay with them until the ambulance has arrived. Even if they're still unconscious, still keep talking to them as they may still be able to hear you, and this also helps to reassure them.